Hello, everyone. Welcome to the Mental Reality Addiction and Recovery webinar with Dr. Beach, forensic psychiatrist and host of the podcast Mental Reality with Dr. Beach, and Mr. Scott Silverman, crisis coach, care navigator, CNN hero, and 35 years sober. I'm Kate, and I'll be your moderator for today. They'll begin the discussion with an overview and some practical keys to treatment and recovery. Then they'll spend a majority of the time answering your questions. So feel free to submit them into the chat box on your screen. Please note, this discussion is not a professional treatment or doctor-patient relationship. With that, Dr. Beach, take it away.
Thanks so much, Kate, for that introduction. And Scott and I are really psyched to have you here today for this webinar on addiction and how to recover from addiction. And addiction is a very important topic that affects us all, either directly, personally, or within our families, or more broadly within our communities. And never more than now during the COVID pandemic do we need help discussing addiction, because we're going through a lot of increased health anxiety, depression, social isolation and loneliness, increased rates of suicide. And those are some of the many triggers that can lead people to use or relapse into substance use. Right now, we're also facing a lot of economic uncertainty. And as many of you will know, we're going through kind of very concerning racial tensions and racism at this time. So we thought this would be a perfect time to talk about addiction. So Scott, maybe I'll turn things over to you in terms of, I know you're working with people on a daily basis. What kind of things are you hearing from people and at this time?
Thanks, Dr. Beach. Scott Silverman here. Really nice to be here and be part of this. And Kate, thank you for handling everything in the back office to make sure we look as good as we possibly can. Before we get started, if you don't mind, and to honor George Floyd, the gentleman who was just recently murdered, in Minnesota, I'd like to just take 30 seconds for everyone just to kind of close their eyes and breathe in and out, and then we'll kind of get centered. Then I'll start my opening remarks, if that's okay. So let's take 30 seconds and just think about where you are today. Be mindful of the fact that you're here with us, and hopefully we're going to share some great ideas of hope and help as well. So 30 seconds of just quiet time for you to practice some self-care. Thank you for that. So we, as the doctor said, we're in some very unusual times right now. We're going to talk a little bit in the beginning here about some reality that's going on, but I think it's important for us to understand that, we're in some very unusual times between the COVID virus, people losing jobs, families in crisis, overdose crisis is continuing, and the opioid crisis continuing. We just experienced in the news just a week ago that over the last 30 days, month, we've had more suicides in our country than we did over the last 12 months. So clearly, we're all struggling right now, and I don't care who you are, or how much you have or don't have, or where you live, or what your economic positioning is. We're going through some tough times. The good news is there is hope and help, and we're going to talk a lot about that today, but we're going to need to hear from you and want to hear your questions on what is it you want to know right now. What is it we can help with right now? And if we can't help you right now, there's going to be some ways to follow up, and that information will be shared through this segment today to give you opportunities to make some phone calls, if not do some outreach directly in your community. So I think where I left off is we're going to hopefully today with your questions address some of the things that are on your mind and on your heart, and no matter where you are in the country or the world, there's help and there's hope, and we're going to try to address some of the mechanisms and how to navigate that so you can get those questions asked and answered. So thank you all for joining us today and being part of what the doctor and I hope will be a very successful few minutes together to address some of the issues that are going on in your world and how we might be a resource for you and your family. So back to you, Doc.
Yeah, Kate, do we have any questions at this point?
I have a few questions that have come in prior to the meeting, which were on email. And the first question is, what are a few approaches you can recommend for me to stop smoking?
Okay, that's a great question. So, as an overview, I think for any addiction, and we're going to be focusing some on substances, but obviously addiction can relate more broadly, whether it's gambling, sex, food, you name it. For any addiction, I think one of the important points is that it's highly individualized. There are some specific substance-related treatments that will apply to some drugs more than others. In terms of nicotine, what I found to be very important in working with people to abstain is to realize that it's often not an all or nothing thing. And by that, I mean, the studies show that on average, people will need to stop smoking an average of 7 times in order to be successful. And you may have heard of the term lapse versus relapse. And I think with drugs, and particularly nicotine, that's a really important concept to keep in mind, that someone can have a lapse, but that doesn't mean that you can't try again. And every day is a new opportunity in order to try to come up with new techniques or skills to, maintain abstinence or sobriety. And I think sometimes when people, fall off the wagon or they have a lapse, if they can view it as more of a lapse than a full relapse, then it's not so disheartening to people, and people feel more hopeful that they're ultimately going to be successful. In terms of nicotine, I mean, I think if you think of there's biopsychosocial and spiritual approaches that you could apply to most substances. So biological, we often think of medications, and there actually are effective medications to help with nicotine. I won't list them all, but they include things like Zyban. Some people may have heard of that. It's also used as an antidepressant called Wellbutrin. Some people use nicotine replacement, Nicorette gum. There's Nicorette patch. And there's also medications that actually affect the nicotine receptors that cigarettes impact, that can also reduce cravings and desire to smoke. An example would be Chantix. And that often works well when people are quite motivated and have a desire to stop smoking. I mean, Scott, maybe I'll hand things over to you. Those are some of the kind of biological. What's your sense regarding, nicotine in particular and some techniques that have been helpful?
Well, it's interesting. I was a 3-pack-a-day smoker after I was 5 years clean and sober. And I was in this interesting class where it was very structured. So I'm going to approach it from an anecdotal perspective. And what it was, I think, called smoke enders during those days. I'm still maybe around, where you take a little piece of paper with your pack of cigarettes, and every time you go to light a cigarette, you're supposed to write down what was on your mind or what you were thinking about or what you were feeling. The problem was the lines were so small, I couldn't get everything in there, so I had to carry a big sheet of paper. So I was carrying a big pad of paper in my cigarettes, and it got very laborious. So in my 3rd week in the class, I actually asked the facilitator, I said, why is there so much work that we have to do to quit smoking? And the response I got was, look, if you don't like the format, why don't you just quit on your own? So it's interesting. I went home that night, I had my last cigarette. So I think, to answer your question, what would I think about is, when you're ready to stop doing something, especially when it comes to an addiction, you have to get some support and some clinical help and understand some of the behaviors that go around it. And then what you do is you listen to the person that's sharing with you, and you take and make the commitment to work on whatever process is best for you. I mean, doing anything cold turkey, I would never suggest, but sometimes you have to for health reasons. So the good news is, if you're really ready and you really want to quit, and you're not seeing any upside to your smoking, then seek some help, ask for help, and know that there is help, and know that doing it alone is almost impossible. So that's really my highest and best advice. Ask for the help, know it's something that you just can't do on your own, and find out whether you get medication, you chew the Nicorette gum, and I think there's some other medications. I'm sure there's some holistic ones out there. I haven't smoked in decades. But cigarette smoking is a very difficult habit. It's not like food. You have to eat, but you don't have to smoke. And I think it was all that secondhand smoke and all the people complaining around me that really irritated me, and that got me motivated. But I think the bottom line is, I was ready. I asked for help. The help didn't work the way I wanted, but I think it triggered something inside of me, and it was my time, and I did quit, and I haven't smoked a cigarette since.
Right, that's really important. I mean, you mentioned, Scott, when you're ready, which kind of makes me think of one of the things I know you and I were hoping to cover is kind of around change readiness. and the stages of change. So I'm just going to put up a slide here that includes the stages of change, which is a model from research by Prochaska and DiClemente out of the 1970s that actually was focused on nicotine. And why this is really important is that, many of you will know that you can want someone to address their addiction, and it can be disheartening and heartbreaking to see kind of someone in the throes of addiction. And it can be so painful when you want someone to change their behavior, but they don't change their behavior because they're not ready. And it's in that spirit that this model, the 6 stages of change, I thought would be helpful to kind of think about how we go about making change and how that might relate to where people are at. The first stage is pre-contemplation. Essentially, that means that the person's not intending to change. And at that point, the person views the cons of quitting as greater than the pros. And so there's no change at that point. As people become more ambivalent, they move to what's called the contemplation phase. And that's usually where people are quite ambivalent, but they're beginning to weigh both the pros and cons to using or not using. And then people will move to what's called either the preparation or determination phase. And in that phase, people will be thinking much more concretely about the possibility of change. They may have identified, a stop date, but they're not actually taking concrete actions. They're more in the planning phase. And then when people move to the 4th phase, which is called the action phase, that's where someone's actually, stopped using. And during that phase, it's really important to kind of gain skills and maintain skills rather than using. And then after people have kind of stopped or abstained for 6 months, they talk about a maintenance phase, which is a really important phase. And that's where a lot of people are doing their work in maintaining their recovery. So after someone hasn't used for 6 months, people will typically talk of someone moving to the maintenance phase. And a lot of the work done here is really important because it includes things like it might be taking medications or individual or group therapy, social support, 12-step facilitation groups. And there's a real focus in this phase on preventing relapse, which is always a risk. And that kind of brings you to the 6th phase. Termination, some people talk about that. The idea with termination is when you've kind of worked these steps and you're quote unquote recovered, and you're no longer having to kind of work in that process. You're no longer having any desire to use, and you've beat your addiction, if you will. And then relapse, which is always a risk, and people are working at trying to prevent and avoid relapses. I mean, I find these stages of change very helpful because you can think within it kind of where you're at and how you might move to the next stages. And there's a lot of learning that can take place. And I've listed them here 1 to 6, but of course you can come in or out of any of the different stages. Scott, maybe, thinking about those stages, I mean, you mentioned with cigarette smoking kind of being ready. I know in your work with care navigation and, as a crisis coach, I'm wondering, how you feel these stages kind of relate to what you see with talking to people.
Well, and these steps are awesome, Dr. The thing that's nice about being able to once again speak to somebody who understands the science behind change. But I'm going to back up just a little bit. And what I find is when I'm talking with families, there's first of all there's the big fear. The individual who's under the influence of something mood altering or self-medicating or acting out, or they're living in their addiction, whether it be cigarette smoking or gambling or sex, or self-medication or prescription medication or street drugs, generally there's a fear factor. The fear factor that I've experienced with people is, and we're going to talk about the addict, for example, addiction to me is a disease. And if you suffer from this disease, like diabetes, you didn't wake up one morning and say to yourself, oh, I wish I had something I could really lean on that potentially would kill me every day when I attempt to do it. So what happens is when you realize you've got this disease or you suffer from this disease and you understand that, it's not your fault. So when you think about that fear of what happened, the fear being, what happens when I remove that? Or every time I quit, I seem to go crazy, or my mind, just won't rest, or I can't sleep, or, I end up substituting and I end up creating more havoc for myself. So I go back to whatever that choice was that I thought was, really creating some self-care. But it wasn't, because it was really damaging me. So getting past the fear factor and understanding that there is help and that you can change, and with change, when you get to the other end, the outcome is going to be very positive. So once you've been able to settle somebody down with that, and maybe the family members as well, who are influencing some of that behavior, or the individual justifies, their own means of taking something in that's inappropriate or not healthy. It's being stimulated by the family who's saying things like, why don't you quit? Or you should change, or why don't you stop doing that? The problem with that is those are trigger words. I call them trigger words. So going back to your 6 points, once you can get someone to understand if they're uncomfortable, and I like to ask people, if this is working for you, if what you're doing is adding value to your life and you're really excited about it, don't change a thing. But if your health's being impacted, you're not sleeping well, you're fighting with your family, your friends, your coworkers, and there's something that you need to do about it, look into it, because there is a way to do it. And once you get past that and you can make that decision that it's okay to try not to do it, kind of like renting space versus buying something, and
Right.
then experiment with other tools and watch how quickly, once you move past that fear, getting into the solution can really be a path of comfort and also of health benefits at every path.
Yeah, Scott, I mean, that's really powerful. And I mean, one of the challenges I think of is, at some level, addiction, you could often think of as a disease of denial. And it's really hard to kind of fix, a challenging behavior or a problem when you're in denial. And, I'm glad you brought up diabetes, but with addiction, there's oftentimes a lot more stigma. And that's one of the reasons, I wanted to have this discussion so that we get the topic of addiction, which is very common, really out into the open, and we normalize that behavior, and we try to help people, the way we would with diabetes. If someone had diabetes, that doesn't have the same, shame or stigma. You wouldn't be, for example, embarrassed at dinner to talk about, needing to alter your lifestyle or maybe lose some weight, or if you needed insulin or medications. But with addiction, both the person who's suffering and their family, there can be that stigma that makes it very difficult.
And in a family environment, because it's classified as a family disease, also defined as the inability to feel feelings, and of course the disease of denial. So when you put all three of those, legs on a stool, you're not going to be able to sit comfortably. So to be able to, be honest and confront the fact that you really don't know how to stop, and being able to look to the family, because if somebody, had the symptoms of diabetes, nobody hesitates. You go to the doctor, you get your assessment, the doctor does the diagnosis, they give you the tools that you need, appropriate medication, ways to measure, your blood sugar level throughout the day. But when it comes to the disease of addiction, it's like, oh, Johnny will be fine. He's tried to quit. He's done okay. There's a lot of stress at work. His clothes are too loose or too tight, or he lost his job, or things aren't going well in his relationship. As family members, we tend to enable that individual to a point where sometimes what we're saying to them contributes to the denial. It contributes to the inability to feel the feelings. So when you think about it, and you're right, that reducing the stigma is probably going to be one of the most creative things that we can do to create systemic change when it comes to addiction. And addiction right now is killing hundreds of people every day. There is a solution for diabetes. And, as we're seeing now with the COVID virus, they're working on different ways to try to create some sort of antibodies and a cure. But sometimes these cures are going to take years. So my attitude is, I don't want to go to any more funerals. So anything I can do to help a family navigate what next steps look like and how to deal with the fear and the anger and the frustration, it's critical, because those are the poisons and the toxins, if you will, that really prevent someone from going and getting help. Because when I talk to people, this is fascinating. I find 9.5 out of 10 people that call me are not the drug addict or the alcoholic or the person who's suffering. It's actually a family member who's suffering from the person who is suffering.
Right. And I mean, we talk about addiction, truly. I'm glad you brought that up, being a family disease, which is not always how people think about it. But if you've been involved with it kind of intimately within your family, I think that starts to make more sense, kind of the impact it has on the entire, system and the family. As well, there can be situations where, where families have codependency within the family, or the family members may collude in some of the addictive behavior that make it very difficult or even impossible for someone to recover.
I Completely agree. So when we talk with people, we talk about the family, and it's fascinating. There was a study done, I can't quote it specifically, but when people go through like a traditional 28-day program and they do nothing else, there's no continuum, there's no follow-up to your 6 points, meaning they go in, they check in, they get what they need, and they're on this pink cloud, but they end up relapsing because 28-day program with no follow-up, according to science, 95% of the individuals will relapse when it comes to mood-altering substances. And what's fascinating is, according to science, 75% of those relapses are triggered by family. And it's not on purpose. It's just part of the family dynamic of the disease, that if somebody goes in for help and the rest of the members of the family, the people who have direct contact with that individual, are not getting educated and or getting support themselves, they could end up triggering the old behavior, and it actually contaminates the recovery process. That's why when we talk to people about the issue of disease, we talk about the family getting help as well. It's really critical, and it improves the entire family dynamic, and it makes it more beneficial. Another quick fact, 15% of our country suffers from addiction that will erupt in the next 12 months. Of those 15% that are moving around the world on a daily basis, they will negatively impact 7 people every day, in their home, on the way to work, at school, even on the golf course if they're retired, because if they're actively using or they're recovering from the night before, they're going to negatively impact 7 people. So if you take the 70% and you add it to the 15% who actively have this disease, that's 85% of our population. And in this current environment, everything is amplified. The fear is amplified. The anger is amplified. The inability to cope, especially most of us being on lockdown, is something most of us have never gone through before. And when I hear about what's going on with families, it is getting scary. So I hope those who are listening and watching today will know that, I'm going to give my number out right now, doctor, if that's okay. It's area code 619-993-2738. 619-993-2738. You can Google me, Scott H. Silverman. Text me, email me. Let's get a conversation started. And when you need the professional help, the doctor, the clinician, the therapist, the psychologist, then I'll do what I can to help you navigate, and of course, being here today with a doctor, the fact that the two of us are talking side by side today is in my opinion, it's so unique, because normally we'd be in our own silo. The doctor would be in his office, I would be in my office, but the fact that we're sitting here talking about it together, it's part of that connectivity to the solution, and it's part of that solution of how we really get people in recovery, help them stay there, and reduce recidivism.
I mean, and Scott, that's why I think it's so helpful and impactful what you do, because a lot of people, one of the things they struggle with is they don't know what kind of help is needed or where to access that help. And so your kind of crisis coach, I mean, a lot of times it's not the addict, him or herself, that's contacting you. It's the family member who's at their wit's end or struggling, and they don't kind of really know where to turn. And that's kind of important. People will kind of suffer or struggle in silence because, they're desperate, but they don't know what to do. So that there's someone like you that's literally only a text message away, really helps to reduce the stigma, right? You're only a text message away. And, I know you also operate, an IOP, an intensive outpatient program focused on addiction, kind of a boutique program. And I'm sure some of the people I would imagine you talk to are, eligible and appropriate for that program, but there's lots of people that need all kinds of different supports and services.
No, and my attitude is, if I can't help you, I will find someone who can. Meaning I dare people to make the phone call, because it's so interesting. Once an individual has made a decision that they're willing to ask for help, and by the way, I need help, probably 3 of the hardest words in our language. So what I like to do is just say, look, let's talk about it. And because I've been in recovery for decades, and because I used to be, I have to say I'm a retired unlicensed pharmacist, I get it. I get a chance to see this from a whole different perspective, and working with professionals like yourself, to be able to lean on you and push people to, because if I'm the virtual portal or the conduit that helps people understand that, because I've been there and I've done it my way, and I could be a resource to them, hence the name Family Navigator. I love that idea and the concept behind it, because if I can't help you, I will find a way to get you on a path where you can get help. I know it's out there. I've seen it. I've experienced it. And I've been through a variety of different treatment modalities. And I'm a firm believer that one size does not fit all. We're all different. So when I hear people say, well, I don't really want to do that, or I don't really believe in this, or, that particular group does, my attitude is, that's an excuse. Continue to use that as long as it's helping you. And when you're ready to ask the questions, we can do it. And 90% of my coaching that I do is by phone. So you don't even have to talk to me in person. And then when you're ready to do that, we'll find the right person for you to talk to.
Right. And when you work with people, along those changes to try to, enhance the change readiness, it kind of another way of looking at it is around motivation. And we all differ in our level of motivation and kind of our commitment towards using or not using. I mean, and one of the therapies that many people find beneficial is actually called motivational interviewing or motivational enhancement therapy. And what I like about that therapy is it doesn't just presume that someone wants to be abstinent. It really validates kind of the struggle, kind of the real pros that people are experiencing from using. And it really, one of the techniques in motivational interviewing is rolling with the resistance, meaning the therapist has to learn to, acknowledge that it's natural for people to have a lot of ambivalence because they've obviously sought a lot of benefits to some degree from their drug use, or they wouldn't be doing it. That may be anesthesia, which isn't healthy, but, is also, self-serving to some degree. It may be escaping from trauma. It may be self-medication of anxiety or depression or loneliness. I mean, even during COVID, I know you see studies that, alcohol consumption is up 70%. That's just astonishing. That obviously reflects where people are at. Also due to the stigma of mental illness, not everyone's comfortable accessing help. They prefer to kind of use or numb things or with anesthesia as opposed to, access kind of, more effective psychological supports.
I absolutely agree. And I think that when families, when most people come into my office, they're not ready. They're kind of, they're taking the pulse, they're taking a sample. They just want to know. And usually they're there because someone else made them come there. Well, my wife wants me to, or my husband wants me to, or they think I have a problem. And then we sit down and I like reflective thinking along with MI, motivational interviewing as well. And we ask some key questions and I don't get into the psychosocial part of it. I'm not a clinician. What I ask is, how are things working? Is everything good at home? How's it going with your kids? How have you experienced the last year or so? And they go, well, it's not that bad. I've only had 2 DUIs, and I did lose $500,000 gambling last year, and I might lose my home, and I think my wife's going to divorce me. I said, well, it sounds like things might be a little out of control, and if that's the case, if you want to change something, where do we start? And really, when you remove the anesthesia, to your point, Doc, some of the real issues really need to be working with. That's why I like the term, you can get into recovery, but learning how to live life on life's terms, especially when you've been anesthetizing yourself for a long period of time. Our time is zipping by, and I see there's a couple questions. Do you want to address a couple of those?
Yeah.
And I'll take some of
Exactly. Yes, this is Kate again. And we do have a couple of questions that have come in on the chat, one of which is from a couple of different people, which I can combine for you to talk about. First of all, thanks for honoring the racial tensions currently. Can you speak to how that anger may be linked to addictions and what people can do to better manage the anger? And another part of that is, can the anger become a barrier to addiction treatment?
Scott, do you want to start on that one, or would you like me to?
You go first, and I'll give the anecdotal side of it, because I think your expertise in the field will be direct, and it will be probably confusing. And then I'll make it simple and say, shut up and listen to somebody else.
Yeah.
I'll let you start.
I mean, I think what I'd say about anger is that it's natural to be angry, over injustice or racism. I mean, people will feel like being angry, like we won't validate someone's right to be angry. And a lot of people aren't comfortable with feelings of anger because they don't necessarily sit well with someone. And we're raised to kind of, you just want to kind of focus on the positive, think the best of everyone. But that's not very reality based. So I think validating that anger is a natural emotion, and it's something that you just have to deal with. Feeling anger is one thing, but how you're going to deal with it I mean, and there's actually specific, treatments for anger. A lot of them focus, in therapy. Most of the anger treatments, one is kind of avoidance. Don't be around people who anger you if possible. And if you need to be, kind of get exposure to trying to, deal with someone in kind of more, more effective and more pro-social ways, as opposed to, resorting to yelling or physical violence, for example. And then there are a lot of times people get angry because they have very extreme views or strong beliefs, like someone's all bad, or they're in a victim situation. So if you can work in therapy to really kind of look at your automatic thoughts that may be causing you to be angry, and you can challenge those thoughts and work with the therapist to come up with alternative thoughts that may be more reality-based, and learning to sit with your thoughts. I know one of the things in addiction that we'll talk about is the importance of learning to sit with your thoughts and not judge them. And that's part of, mindfulness, which, I'm sure lots of people have heard about, and sometimes with yoga, they'll incorporate mindfulness. So learning to kind of sit with your thoughts, let your thoughts go by, but not necessarily attach to them or personalize them. And if you can kind of, get more natural at doing that, Freud, who everyone I'm sure has heard of, talked about learning to become your own observing ego, which is the idea that, how do you get better at being in a certain situation, but also being able to observe yourself and your own thinking and behavior. If you can develop that ability, which at first isn't natural, people don't really think to do that, but the more you can do that, the more you can kind of be reflective, as Scott mentioned, and be in the moment and kind of challenge. Is this really that big of a deal? Is there another way I could look at this? Do I need to be that angry? Is there an alternative explanation that might make me feel better? And a lot of times, just like with a lot of negative emotions, or like with forgiveness, you forgive for yourself more than you necessarily even forgive for other people. So if you can kind of approach anger that way, anger isn't good for you. It doesn't usually cause a positive impact on your mind or your body. Scott, what were some of your thoughts on anger?
Oh, completely different than yours. But no, I think that the way you frame it, Dr. Beach, I think is important. But I'm gonna approach this like from what I'm gonna call a person who's actually suffered, who's actually attempted suicide, who's been through some very high lows and some very low lows. And what I have learned is, and everything you said is accurate, but what I find is in the beginning with someone who suffers from this disease, living with their own thoughts. I mean, I still have a saying, and I've been sober 35 plus years, that my mind is like a bad neighborhood. I do not go there alone.
That's powerful.
So what I try to talk with people about is, because what you said is great. I mean, live with your thoughts, let them wash over you. But the problem is when people are mood altering, when they're taking and self-medicating, what happens is the logic of what you just unveiled doesn't, in my opinion, it doesn't make sense to them initially, because their thinking is, well, if I was thinking right, why would I be doing what I'm doing? And if I'm doing what I'm doing, how am I supposed to think right? So what I think about is, I think that anger, if you will, is a shield for fear. So when you think about it, I'll use the appropriate acronym, so it's because it's a public domain here, is forget everything and run. And that's what fear is. And to the individual's question about what to do with anger is, I talk about what is it, what are you afraid of? What is it that's causing you to think about this anger? And to me, the fear that we're seeing right now across this country with what's going on, I see, yes, people appear to be acting out and they seem to be angry, but there's a lot of fear that's underlying there. That's, and when you think about it, a substance abuser, their untreated trauma, meaning they've gone for long periods of time in their life with something that triggered something, and it goes on, and then they anesthetize themselves, and whatever that underlying issue is, it can't even be treated. And correct me if I'm wrong, Doc, it can't be treated till you remove the anesthesia. So that being said, I believe if I can convince somebody that the anger that they're experiencing could be a shield for fear, it's not always, but could be, let's talk about what you're afraid of. It could be change. It could be being, the covers being pulled. It could be learning how to deal with what's going on around you in a way you've not been able to do in a long time. Or you don't know why you do what you do, but you can't get to the root of it until you address what the issue is. And the issue initially is the anesthesia. How do you remove the mood altering substances so you can really start to do the work that, that no matter how good I think I am, until it gets to someone who really understands that behavioral side of it, it's really hard to create systemic change.
I mean, you mentioned the root, and I think it's really important in kind of assessing people around addiction to really understand what's at the root cause. And I think we've already alluded to some of the common things that you'll find at the root cause of addiction. Trauma is a big one. And a lot of times people aren't even, learning kind of how your substance use or addiction relates to trauma isn't always kind of a natural link that people make. They need to learn that from kind of doing a deeper dive, and analyzing things to really kind of understand. But you're totally right, Scott. So you need to learn how to deal with anxiety or trauma when you're anesthetized. It's not really a good it's not a good learning ground, if you will, right? You need to remove that anesthesia in order to kind of come up with alternative coping skills or new learning.
Right. And what I've learned, and don't take this wrong, Doc, but as we get to know each other better, you'll understand the reason behind my mild insanity. But trying to work with somebody once a week who's been through a deep dive into their disease for years is hard. And I'm sure, and I know that the work that you do, you make recommendations, but people really need to get into some full immersion initially. I mean, we've heard about mindfulness for years, and I still, the definition I love the most is how to learn how to live life in the moment. And when you talk to somebody who, I suffer from ADHD, I have an 8-second attention span, to be able to try to, even today with a pretty clear head and a long-term sobriety, there's something about what the disease has done to my mind, body, and soul that makes it harder for me when I'm sitting in a room, and being able to do full immersion. And what I mean by that is there's different levels of treatment. We won't necessarily go into that today, like, detox, inpatient, outpatient, continued care, ongoing recovery. Those are, important pieces of the continuum, meaning when you go to work out and you want to be a marathon runner, you don't do it in a weekend. It takes months, if not years, to really perfect your style and what it is you want and need to do. And you have to make, ancillary adjustments that may impact your entire life. But if it's a goal you want to set and you understand what those tools are, there's ways to work around it.
Right. I mean, being in the moment, easier said than done, when a lot of times what people are struggling with is still grappling or trying to process past traumas or worried about the future. And the past and the future are opposite of what you're talking about. Learning to just be in the moment.
So what's our next question, Katie?
So yes, we have another really good question from the chat section. It's frustrating for family members to watch someone killing themselves with drugs when they are out of their minds and dangerous. How do you help them get help, especially if they are not seeing it themselves?
Part of what has to, what I've experienced with family members is they're so distraught. They're so angry and frustrated. The one question I love, I get more than anything else, is how do you know if the person in my life is telling the truth? And my answer is, if their lips are moving, they're not telling the truth. So with disease of denial, the 3 best skills of an addict are they're liars and cheaters and manipulators. Not because they think it's the best behavior to have, but it's an outcome of trying to preserve, if you will, and I'm going to spin the words here, the integrity of their wanting to get high and stay high. So if you know that about somebody, you can listen to them differently. So I start with the family with when I hear them say, my son won't listen. He's more angry than ever. He just won't do, what he says he's going to do. He doesn't follow through. And now he's stealing money or he's taking jewelry. So I said, so why not put your money and your jewelry away? Let's put some speed bumps up, without enabling any further than we currently are. Well, and he has his father's car. I said, why does he have his father's car? Well, he wrecked his. So let's take the car away, or let's just limit the ability for the individual to be in the car. So we start to talk about what the family can do to put in some underlying foundations for change, limiting or eliminating some of the things that the family is doing that potentially could be contributing when I hear a parent tell me when they've got a 16-year-old, I don't know where they're getting their drugs, and then we start to break down, they're giving them an allowance, they have a gas card, and they have access to the family's American Express card. So once we control that, cut it off sometimes if we have to, then the child has to ask for help. And once they start asking for help or support, that's when we can start to help shift some of their thinking. Well, if you want this, we're going to need to participate, creating a plan that works for all of us, because we're no longer going to be held hostage by your behavior. I'm not suggesting you say that, but I'm just suggesting that we build this, the language has to change with the family until the person who's suffering from the addiction learns how to speak a different way and live a different way. That's how we can support them.
Right. And they'll talk about, you'll talk about not wanting to reinforce behaviors you don't want repeated. So I think that's kind of a little bit kind of what you're alluding to there. But that's so difficult when it's your loved one and you're worried if you kick them out of the house in order to, provide some tough love or teach them a lesson, that they'll end up on the street or end up dead or end up in prison. Those are the things that people really grapple with. And so that's easy to say, but really hard to do when you're worried that the consequences of that decision could be death and the guilt that you feel, if something bad were to happen.
Well, and what happened is something actually as bad is actually happening when it's going on. So the thinking of, well, if I do this, what if they become homeless? If I do that, they may not like me. Well, if you don't do something, we're going to go to their funeral. I mean, jails, institutions, or death, sobriety, those are the options. So especially if someone's been on a path and you've watched them over the years, and when I hear families say, well, this has been going on for 8 years, and I said, what have you suggested they do? What have they been willing to do? And most of the time the answer is they tell me they're going to quit, or we've learned to live with it. And my question is, why? You have a choice. You always have a choice. They have a choice. But helping people get to the point where they can make decisions with choices, that's the hard part. That's where the motivational interviewing, that's where I use reflective thinking. Right. That's where I try to hold the mirror up, and then I use my own story if that's helpful as well. There are some ways to symbiotically connect with somebody, and if I can't, then I try to make a referral to get them to somebody who can help them. And unfortunately, the way insurance is set up in our world today, you go here and you get that, and if you can't get that, you give up. So, part of having that transformational opportunity is really holding the hand of the whole family, not just the individual who's got the direct problem, because everyone's impacted by it.
Yeah, and I think people, it's natural to kind of, hope that a problem will go away, or, have a very active imagination or fantasy. And, people may have motivation to go and do a rehab, right? And they may do very well. And, they say the road to hell is paved with good intentions. And it's very common people will do well in a, say a 28-day rehab. But then when they get out of that rehab, right, they may have the best intentions. But if they don't have the aftercare and they don't have the skills and commitment to, continue working on their recovery, they're often returned to the exact same situation and stressors and people and traumas that reinforce their substance use or addiction to begin with. So, you'll find that the programs that work the best really pay attention to that aftercare program. I mean, it's not that shocking that if someone's, locked up in rehab for 28 days where there isn't access to drugs, that they maintain their sobriety. But it shouldn't be that shocking when they get out, right? And they have to face kind of the real world and some of the stressors that led to, that reinforces their addiction, that they end up in that same kind of powerful habitual cycle that's so ingrained.
No, I completely agree. And learning how to live life sober is really hard to do in a zero tolerance environment. But the detoxing obviously is really important for individuals to go through. So, I think you and I certainly are aligned, and I hope people are hearing what we're saying today and it makes sense to them as well. So, Katie, back to you. Do we have another question that we can answer?
Yes, we do. We had one come in as a comment on one of the emails sent out. My son recently completed a rehab program, and while I don't want to worry every day, I would like to know some indicators that he might not be doing as well as I thought and lead to a possible relapse.
Oh, that's a really good question. So kind of signs of potential relapse.
Yes. Yes.
I can make a couple of broad comments, and then Scott, I'd be really interested, since you have 35 years under your belt, I'd be really interested kind of in the work you do and, in your recovery, kind of your ideas. I mean, I'll just say broadly, obviously some of the signs that, someone may have relapsed is that, they're showing that they're intoxicated on a substance, or there could be a withdrawing from a substance. I mean, some of the classic ones that indicate that someone may be using or has relapsed is that you'll notice changes in their thinking or behavior. I mean, in a work setting, some of the things you commonly hear is, someone may be more irritable, they're not showing up for work, they're more late for work, they're calling in sick more, they're having kind of interpersonal disputes or conflict. Those are some of the classic ones that, people will talk about that may give an indication that someone's relapsed. And then there are some times where, depending on the substance or the person, they may not be as interactive or social. They may be kind of like canceling out on, family or social experiences. They may become more withdrawn or isolated. I think those are some of the things that come to mind. Scott?
As a parent, you're going to worry. A parent's worry, that's your job. The addict's job is to try to find a way to get to where they were before. So during that transitional period of, detoxing, and then, think about it, when the individual is under the influence of something mood altering or acting out inappropriately with whatever addiction they may be displaying, they've done it for quite a while. So if you think about how many hours they're under the influence, and then the impact that influence has of the other hours of the week, for someone to replace those 60, 70, 80 hours every week, that takes time. So patience and tolerance is going to be important. But to see, I think the doctor mentioned it, you're going to see mood swings, but mood swings are going to be organic and they're going to be natural anyway from someone who's coming off of something mood altering. Next, the idea is to, there's a saying that God gave us 2 ears and 1 mouth, is to be a good listener. And when I say a good listener, maybe sometimes what that might mean is being a different listener. Example, if you can, while they're going through this transition, spend time with them in a way that maybe was different. Sit down for dinner, maybe have breakfast, maybe go for a walk. And while you're on those times together, listen. Don't ask, how's the job search going? How's it going at school? How's the relationship? How are things at home? Try to be just a good listener. Remember, as a parent, one of the things you did for many years with your child is you listened to them. And over the years, when they weren't listening to you, the thinking was nobody's listening. And when two people are talking, guess what? Nobody is listening. Right. So what I would encourage a parent to do, or family member or significant other, or a sibling, is to listen as best you can. And when they start to go off and they get angry and they see that you're changing a little bit and they start to get mad at you, my answer is simply say, tell me more. And let them continue, because while they're talking and while they're sharing, they're releasing. And when they're releasing something, whatever that anger or that fear or that frustration or anxiety or depression or those feelings are, they're going to get diminished a little bit. And then from that may come some calm. And then you can start to bring in some of the suggestions that you've learned because you've sought help. I mean, there's a ton of anonymous meetings out there for family members, Al-Anon, Narcanon, Alateen, and there's a ton of therapeutic support for family members as well. That's why we said earlier, it's important that the whole family get those tools. I mean, again, your car breaks down, you go right to the mechanic. You can go on YouTube and you can say, well, how do I fix an engine? But if you don't have the skill sets, it's going to take quite a while. And at the end of the day, why do that? Why suffer like that? So when your family starts to make these changes, sometimes having someone like myself, a family navigator, sometimes having a family therapeutic support component, having a doctor involved, and your son or daughter or sibling or significant other maybe need to take medication as well. Medication-assisted treatment is a big, big portal today where people that need it, especially coming off of opioids. So the bottom line is get knowledge, understand what your options and opportunities are, and take advantage of that knowledge and start to defer to others to help you navigate with the family. There's nothing worse than family members who try to fix it, and then when it doesn't work, they take it back and they're even more aggressive. Everyone ends up spending more time, more frustrated, and they end up fighting more. And then eventually someone just ends up shutting up over it and things will escalate. They always do. It's really hard to get better on your own.
I mean, and one of the ways, I do want to move to other questions, but it is highly individualized. And one of the ways I've found is the most helpful to kind of learn what might be effective is to try on different things. Some people really like to take pills rather than talk about problems. And then there's some people who really want to have a deeper understanding and do therapy. Some people like groups, some people like family therapy. You know, some do well kind of, you know, more expressive types of therapies like art therapy or equine therapy, or some do well with, for example, with smoking, hypnosis can help some people. So, I mean, to me,
but the bottom line is one size does not fit all. And, you know, it's like imagine an onion with layers. Recovery is like that. You've got to peel back the layer. You've got to take a look at what's going on. You've got to work on it. You've got to get better at it. And you've got to move forward with it. And again, that yourself, if you don't have the tools, is next to impossible. And I've never actually heard of someone, you know, either, well, I'm going to move to a, you know, a deserted island. I said, okay, then what do you do? Well, I'll come back. Okay, so when you come back,
right,
everything that you left is the same as when you left it. You may have done something different. You know, the things that need to be processed in the mind, body, and soul are a lot more complicated than taking a vacation, even though you might need one. Sorry, Katie, go ahead. What's the next question?
No problem. This question came in prior to the webinar start. I hear a lot about risk factors, and I was wondering how much of an impact the hereditary nature has on addiction.
So what I'd say is increasingly over the last, I'd say 20 years in particular, there have been a lot of good studies on the genetics of addiction. A long time ago, I think people used to think of addiction as more voluntary. I mean, now we think of addiction as, you know, an example of a mental illness. And actually in the, you know, Bible of mental health challenges or disorders, the Diagnostic and Statistical Manual, addiction is one of the mental health disorders. Yet you'll still see a lot of people seeing it as more of a voluntary behavior. And that's one of the frustrations people can have with addicts, is they'll falsely believe that it's a choice and a voluntary choice that they can stop. But of course, by definition, addiction is defined by the inability to kind of control the behavior or abstain from using. I mean, the studies they've done on genetics of addiction, and I mean, the alcohol ones would be the most studied, is that addiction is highly heritable and a lot more heritable than a lot of other mental disorders that we think of. Our latest understanding of addiction in general is that it's highly genetic.
No, I agree. And anecdotally, that, you know, over the years, I've heard that, you know, you have a 50% chance if you had parents who suffered from some form of addiction. But when you think about diabetes and you think about other, you know, diseases like cancer and heart disease, you know, the hereditary plays a big part of it. You know, and as you said, Dr. Beach, you know, that it's been labeled as a moral failing. They call it a moral failing. And that's like saying when somebody goes to a bar, if they don't pick up a drink, they won't have a drinking problem. The problem for a guy like me who has this disease, you know, I would drink before I went to a bar, so I wouldn't look like I had a drinking problem. So, you know, that kind of decision-making process comes from the disease. It wasn't conscious. I mean, why would somebody have 4 drinks before they go to a bar? So they wouldn't look like they're drinking too much. And I can remember over the years I would drink like that, and I didn't understand why, but it was organic for me to make that decision until I'd learned it was highly inappropriate. So what happens is you know, it is in the family, and that they still haven't actually come up with a test yet, and they've talked about it, and they still don't even know exactly how to determine whether someone's going to be able to or not. So at the end of the day, you know, if it's in your family, it's possible it's going to bubble up. And the next question usually is, what do I do about it? You know, stay connected with people you care about, be a good listener, speak from the heart. We have a saying in the program, taking that 12-inch strip from your head to your heart, because the logic model around, well, why don't you just stop drinking? Well, that's like saying, well, why aren't you a better student? Or why can't you run faster? Or why is your hair falling out sooner? Or why is it curly or straight? Some of those things, you know, the answers that you might be seeking for those questions may not exist. And you may have to find a way to sit with yourself and maybe seek some help yourself and ask some key questions of someone who really understands how to better answer them for you and with you.
mean, in that nature nurture kind of debate, it's both things, nature genetic and nurture environmental. I mean, you brought up drinking before going out socially. That can often be a sign of someone having social anxiety. So in that case, is the addiction genetic, or they're coping with, for example, social anxiety by drinking, right? Or liquid courage, as you'll sometimes hear. So it can be complicated when a lot of people use substances to, as an anesthesia to deal with other underlying problems that, aren't treated, or people aren't even aware of the connections between their substance use or addiction and those underlying emotional issues. Kate, I see we have about 5 minutes left. Do we have a last question?
We had over 30 overdoses and 3 deaths in our small town area in just a few days. They say the drugs were laced with fentanyl. I'm not sure what's going on with the drugs today, but can you explain?
The first thing that's coming to mind is, opioids. And when we're hearing a lot about huge surges in kind of fatalities and overdoses, a lot of times it's drugs like opioids or other drugs being laced with drugs like fentanyl. So I'm not sure in this case whether, fentanyl had anything to do with it, but one of the major issues with the opioid crisis that we hear a lot about is that, the drugs aren't pure and they're being laced with drugs like fentanyl, which is highly addictive and powerful.
What's happening nationally is Oxycontin, which was probably the most popular, over-the-counter prescription opioid over the years. In 2016, 264 million prescriptions were written for Oxycontin. And what's happened is the last few years, the script writing slowed down, big pharma's being sued, doctors don't write scripts like they used to, pharmacies double, triple check, and fentanyl has become a huge opioid, and it can be manufactured at home. China was one of the biggest distributors and we were importing it, or it's being exported to the US because we're one of the biggest consumers of fentanyl that's not prescribed. And fentanyl can be mixed with, as the doctor said, with heroin, it can be mixed with marijuana. And what happens with the manufacturing domestically in people's garages with fentanyl, there's no quality control. So we're seeing these overdoses, and a lot of it's behind the fentanyl that's being cut with the other traditional opioids. And then there's there's the fake medication that people are taking where they think they're taking a Xanax, for example, and it's actually cut with fentanyl. So this, the medication that people are taking that's being manufactured domestically. I mean, you can go online to Amazon and buy capsules, and you can mix your own, and you can buy almost any drug today on the dark web. So that's really why we're seeing this. Opioid overdoses are north of 200 per day. And that pandemic inside of this pandemic has gotten worse, not better. So once we, start moving forward, the conversation must continue, because as the prescription drugs are being stowed away in medicine cabinet and stolen by different generations of family members or healthcare providers in the home, we're going to see people substituting with what's happening now. Here in San Diego, just in the last year, fentanyl overdoses have increased a little over 32%, just in San Diego.
Wow.
And we're a border town, and one of our big drugs of choice in this community is methamphetamine, because it comes through San Diego to be exported across the country. And obviously with legalized marijuana, it's a whole nother discussion for another day. But at the end of the day, the opioid crisis is not going to go away. And just because Big Pharma isn't making Oxycontin like they used to, doesn't mean that's going to stop either. So really be informed, make sure your kids are informed. And when they go to parties, they don't just take something, they call them Skittles out of a bowl now, because they never know what they're getting. There's nothing worse than hearing about a 21-year-old that went to a party to celebrate, and now, they're in the morgue trying to figure out what in the heck happened.
Right. So in terms of a few closing remarks, and Scott, I'd be interested in yours as well. I mean, some things that are resonating with me is you made the comment, the power of I need help, and that can be a real challenge. So to me, that's one of the take homes is, it's very important if you're going to get help to acknowledge that you need help. And what's I've always found amazing is those 3 powerful words. When you say that, there are so many people who care. There is a lot of help to be had, and there addiction is a disease, but it's a treatable disease. You're not alone, and it's not something you want to tackle alone because, it's very complex and you really need support. So take advantage of all the supports that are there and try different supports on. And, we're not perfect. It's not all or nothing. And build into the process that, there may be lapses at times, but that doesn't mean there's no hope. You can always kind of start again tomorrow. Each new day is a fresh opportunity, to try again and learn new skills, and work towards recovery. And, recovery is work. It's not something, you don't wave a magic wand and, you're cured of addiction. It's something you have to continue to work at in order to maintain your abstinence. Scott?
I agree with you, and I like doing this with you because I agree with you. And we're so different spectrums from the treatment modality perspective, but there's a lot of crossover that really needs to be met, and I think it's going to be a way that we're going to see how we reduce recidivism. It's a family disease, and as I'm listening to you talk about I need help, because I talk about that a lot, and earlier I shared, if somebody, I used to teach a class where we tell people, hey, you got to go back to school. Well, if you don't know how to go get an application and walk onto a campus and you don't have those skill sets, you're not going to know how to go back to school, and you may not have been at school for a long time. So when it comes to asking for help, I'd like to add, maybe ask somebody, what does help look like? So make it even easier for people to engage in that. So instead of saying I need help, which is an admission of some sort of weakness or maybe some sort of failing, just say, what does help look like if I think I might need help, if that softens it for people, but I don't want to be too codependent around that. Next, I want to say that, asking for help is something that, anyone in the family can do, and that starts the process. Next, one size does not fit all. So if this doesn't feel like it works for you, don't be afraid to try something else. And when you're seeking resources for help, don't be afraid to Google them, check their resources, look at their reviews, go to Yelp, talk to somebody who's in the field. Get some support around that. You shouldn't have to do this alone. It's a big decision. And if someone's been under the influence for a long period of time, you can't go to a weekend course and come back Monday and go, everything's fine. Just doesn't work that way. So don't be afraid to ask for help. Don't be afraid to understand that it is a disease. And also, as a parent or a family member, this is not your fault. You did not do this. And there isn't something that you didn't do that you should have done that could have prevented it. Just like diabetes. So if it's in front of you, embrace it, because it's not going to go away on its own. And I want to thank you all for being here today and listening. And again, reach me at area code 619-993-2738. yourcrisiscoach.com is my website. Confidential Recovery is the outpatient program here in San Diego. And know that anything that I can do to be helpful and to support, I'm willing to do.
Great, and I just want to echo Scott's sentiments. I think this has been a really educational webinar. I know I've learned a lot. I always do from Scott. I want to thank Scott and Kate for their help organizing things today and their participation. And thanks to everyone who joined. Scott and I actually did a podcast episode of Mental Reality with Dr. Beach on addiction and recovery. So if you haven't listened to that, I'd encourage you to do so. There's actually a number of other podcast episodes that relate to the topic of addiction. Scott mentioned, in the California area, we really struggle with meth, and there's a particular type of meth called super meth. When Dr. Ryan Salahi and I did an episode on super meth. We also have a lot of coverage of the topic of addiction in our homeless series. You can hear more about the podcast and me at reachdrbeach.com. Like us on Instagram or Facebook, and check out Mental Reality with Dr. Beach. So thank you very much, and enjoy the rest of your day.